The question is, I'm hopeful, but what do you see the advancement of, diet and nutrition, health and nutrition in the next decade? What do you see as, especially in Africa? Here at Dr. Mura Health, we focus more, of course, the world free of lifestyle diseases, but starting with Africa. How do you see us moving for the next 10 years?
Well, Ernest, I think there's only so much you and I can do. I would like to see the government being more proactive. I know that in South Africa, there has been a new obesity guideline. Well, I don't know if you can call it a guideline, but there is a plan, an obesity and over management plan that's been presented for the next 5 years. So that's a good start. But we have to realize that we're living in an obesogenic environment, that everywhere we turn, we're just faced with the food industry, the ultra processed foods, the marketing. Our kids are bombarded with this information on a daily basis, and so it really means that that there needs to be changes in policy, and that's got to come from the top, from the government. Yes, so we're very grateful in South Africa to have a sugar tax that doesn't exist in many places around the world. But there's a lot more that can be done. And I would like to see more being done in hospitals.
Yeah.
I would like to see food, more being done to serve good quality, healthy food to people who are recovering in hospitals. Yeah. It just makes me so angry when you have a person who's just gone into hospital for a coronary artery bypass graft, and then in hospital they are given a hamburger and chips. What a wasted opportunity.
I know. And it's so sad. It's and also beside that, what the precedence that it gives to the patients, say like, oh, this actually must be healthy food. Not only while they're in the hospital, if they happen to be discharged, they continue eating the same way because I was served the same food in the hospital. How bad can that be?
Yeah,
that's
exactly.
very sad. Yeah. And so Lydia, the looking, of course, what you say is very, very true. And the government, the policy is changing. And I think also we need to have a lot of course, health, which word, but I don't know which word to use. We needed to start probing the government to make some changes because it's very sad. It's not only here in South Africa, and they're looking in the US, talking about the first leading cause of death in the US, which is heart disease. Yes, we have like people like, Dini Onish having shown for the last more than 30 years how, that they are number one, killers can actually be treated and even be reversed, but people still dying is still the first leading cause of death. So we still really have more work to do. But just a little bit last question also, if you have, that is 17, 18-year-old, I don't know, now they can even be 16, going to medical school, what can you tell them? How can you guide them? What can you tell them that can help them as they actually, when they start learning this, they can start exploring more about the really true healing of food as a medicine?
Yes, well, I would love to see the curriculum change, and I'm hopeful that it will sooner rather than later. But in the meantime, I know that there are some student groups that are starting at some of the universities and some of the medical schools that are being run or facilitated by an organization called PAN SA.
Yes.
Which is the Physicians Association for Nutrition. Is that right?
For nutrition, yes.
Yes. And they have a South African branch. And they have been fantastic in setting up groups at a few of the main universities around South Africa. So I would encourage medical students to go and see what those groups are all about, educate themselves. They can also join SALMA for free. We don't charge students any membership fees, and we provide lots of resources. Yes, I think that the movement's growing, and I would encourage medical students to look to those areas. Yeah,
definitely.